Good morning, everyone. Thank you for joining us and welcome. Today, we're going to have our Northern Light Health Good Health is Good Business Zoom conference, and I'm very excited for today. I hope you are as well. For those of you who have attended one of our Zoom conferences before, I'm sure you will agree that some of the most important insights shared by our panelists have been during our question and answer segment, which traditionally follows our more formal presentations. Given that we have decided to dedicate the bulk of our hour today, we're going to ask that you bring your questions. We're ready for them. What is top of mind for you, your employees, your family, and friends? I'm Karen Hawks, Vice President of Operations at Northern Light Beacon Health, and I will be your moderator for the next hour. Our expert panelists today are Dr. Ed Gilkey, Senior Physician Executive for Northern Light Beacon Health, and today he is going to provide the COVID-19 update. Dr. Jim Jarvis, the Senior Physician Executive and Director of Clinical Education at Northern Light Eastern Maine Medical Center. And Dr. Jarvis also serves as the COVID-19 Response Incident Commander. Yamaya Sinclair, a licensed clinical professional counselor for Northern Light Workforce. And Dr. Elizabeth Marnick, an immunologist and associate professor of molecular biochemistry at Hudson University. So before we get started with today's panel discussion, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. So this hour is designed for you, and we invite you to submit your questions at any time during the question and answer, using the question and answer function. In fact, we encourage your questions. That is what today is all about. Also, I hope each of you will take a few minutes immediately following this hour to answer our 5-question survey. Your input directly affects our topics and helps guide our future conferences. So Dr. Gilkey is going to get us started today by setting the stage with a COVID-19 update. Dr. Gilkey.
Well, thanks, Karen. The COVID-19 pandemic is still with us and no end is in sight. In fact, a recent sobering milestone has been reached. 1 in every 500 Americans have died in the last 18 months due to COVID-19. 1 in every 500. Let's get a better understanding of where we are in the pandemic. This graph shows the large Delta variant surge occurring now in the US on the far right. The light blue daily counts are very variable. The dark blue trend line shows the cases are decreasing in the country. This may be some good news. However, some states are currently improving and others are worsening. So more to the story. Let's take a look at Maine. This data is from the end of September. Since then, some regions are improving and some are at their worst. Let's focus on the light blue daily cases. And you look on the far right again. They are as high as last winter. Both of these graphs are concerning. Even if the Delta variant surge does improve, the anticipated winter surge may happen from a much higher baseline, like halfway up this last peak. If you think about starting from there, oh my goodness, we could see more daily cases than we've seen previously. Now let's take a look at vaccinations. We know vaccinations are our best way of fighting this pandemic and hopefully ending it. Let's focus again on the US and Maine. These percentages are fully vaccinated, not at least 1 dose, so it's reported in several ways. The country is over half fully vaccinated, and Maine is now approaching 69% fully vaccinated. We are far ahead of many countries and behind a few. Remember, this isn't only about Maine and the US, it's about the whole world. Less than half the population of the world has received at least 1 dose. In fact, in low-income countries, only 2.3% of the people have received at least 1 dose. The good news is that over 6 billion, with a B as in boy, 6 billion doses have been administered. And we have lots of data showing the vaccines are very safe and adverse reactions are rare. Bad effects do happen, but not at all frequently. This is very important to recognize. In spite of the seemingly large number of vaccinations, still each vaccination counts towards putting the COVID-19 behind us. Let's look at some key points to consider. Hospitalizations are high, with some regions starting to improve. Staff throughout Maine are overtaxed. Facilities are at or near capacity. Staffed ICU beds are extremely limited statewide. Deaths are high and mostly among unvaccinated people. Many of these hospitalizations and most of the deaths are entirely preventable by vaccinations. So I'm going to repeat that. Many of these hospitalizations and most of the deaths are entirely preventable by vaccinations. Boosters are available for the Pfizer vaccine. The selection criteria for the boosters are age greater than 65, underlying medical conditions across all age groups, and that'll define whether it's should or could dosing. High-risk workers, and everyone must be greater than 6 months since the second Pfizer dose or when they became fully vaccinated. This booster can be given at the same time as the flu vaccination in separate arms. This is the recommended approach, and I personally received both those in separate arms on Monday of this week. Taking everything into account, the prime directive is to vaccinate the unvaccinated. This is the path to end the pandemic. Back to you, Karen. Thank you.
Thank you so much, Dr. Gilkey. I think that the information you've shared has certainly probably triggered some questions, and no doubt there's so much coming out daily from the news that triggers my own questions. So please, again, I invite you to use the question and answer function to address questions to our panelists. I'm excited to say that we received a number of questions prior to today's Zoom conference from those of you who have registered. We've actually already started fielding some as well during the last 7 minutes. So we have a lot to cover, and we'll see how much we can get accomplished today. I'm going to ask all of our panelists to turn on their cameras and their microphones, and we'll go ahead and get started. I do have a rather simple question to open the discussion, but when I toss this question to our panelists, and I'm going to ask each of them to answer, I also ask that you introduce yourself just briefly so that people can put a name to a face. I think that's always helpful. So the question is, given your role, what have you found to be the most challenging thing to navigate or overcome professionally as it relates to COVID-19? And I'm going to ask Dr. Marnick, our special guest, to get us started.
Everybody. So I'm Dr. Elizabeth Marnick. I'm an assistant professor at Hudson University, but my background, my PhD work was all in immunology. And in my spare time, I spend a lot of time trying to help address all of the misinformation and disinformation about science and COVID-19 vaccines in general in all sorts of different ways. And I think that brings me to that question. So I think the thing I've struggled with the most is the general distrust of science that this pandemic has really shown a lot of people have, and also the spread of misinformation and disinformation. So figuring out how we move forward from this pandemic and help to rebring trust back into science is something that I worry about a lot.
I'd like to point out, Dr. Marnick, that your worry is probably shared by members of our audience because we've already fielded a question about that exact topic. So we'll get to that. Yamaya.
Thanks so much. Hi, everyone. My name is Yamaya St. Clair, and I am a counselor and trainer and consultant with Workforce EAP, and have had the privilege of really working directly with people who are deeply impacted by the stressors and struggles that come with living and working through a pandemic and leading teams through a pandemic. It's been a really hard time on people's mental health and wellness. And I think the thing that's been most challenging professionally is, some of the tools and coping strategies that we would suggest in other times aren't available, aren't resources that are safe for these times. And so we're a little hampered in our ability to be really effective in providing people, really great ideas and suggestions and ways to move through this. And moving through it feels kind of chronic at this point. So those things that we may have suggested early on, people are like, yeah, I've done that, I've tried that, I'm still in this, it's still hard, and I'm not seeing a lot of hope. And that's really challenging just to sit with in a daily basis and feel the weight of what everyone's carrying.
Thank you, Maya. And thank you so much for what you do, because it can't be, the importance can't be overstated. Dr. Gilkey.
So thanks, Karen. Ed Gilkey. My background includes number of years in practice as a family physician, followed by a host of years as a faculty for a residency program where I taught residents as well as medical students. So that's my pertinent background for today's discussions. And what's most challenging to me is really the vaccine hesitancy that's out there. I have the luxury of spending, probably on average 10 hours a week for the last 18 months on learning about COVID-19, talking with professionals about it, really honing my understanding of what's going on. So the bottom line for me is getting a vaccine, with the rare exception of some medical exceptions, is truly a no-brainer. So how is it different for others? I mean, there's, as in pockets, as many as 50% of people, more typically about 30% of people that are very resistant to or hesitant to get the vaccine. Why is that? I really think a lot about that. So I put together an analogy in my head. Getting a vaccine, the risk of getting a vaccine is sort of like being in Maine, in my house, during a thunderstorm, and being struck by lightning. So yes, that can happen. And yes, bad things can happen with vaccines, we know that, but that's about the relative risk. Compared to getting COVID-19, and there is some age adjustment, I will agree, the older you are, the little bit more risk there is to it. But getting COVID-19 is like being in Florida on a golf course during a thunderstorm, holding a lightning rod. And so I don't really kind of equate the relative risk, how people say, well, I don't trust the government, therefore I'm not going to get a vaccine. Nobody should tell me that it's mandated for me to keep my job, therefore I'm not going to do it. Those are the kind of things I really struggle with. So what I try to do is not to put my bias out there, as you've just heard, but in fact, try to engage with people and understand, what does it look like from their vantage point? What are the things that really concern them? And that's a big challenge. How do you walk in someone else's shoes when you feel so strongly about what the answer is? So that's my biggest challenge, Karen.
Thank you, Dr. Gilkey. Dr. Jarvis.
Good morning. So I'm a family physician by training, and for over 25 years, I have been involved in medical education. My current roles are to continue to oversee education and research for Northern Light Eastern Maine Medical Center, as well as being the lead clinical physician for our response to COVID-19. This is a very interesting question, Karen. It makes me wonder if I wish that Ed was the moderator today. But really, what I like to look at is, one, we've had such incredible successes. And I think we need to always focus on those first. And so, over 70% of all Mainers are now up at least partially vaccinated against COVID-19. We are the fourth best in the country in vaccination rates. Those are phenomenal numbers for us. We can do better, and that's good things. We have done some amazing things throughout the state that other states just didn't seem to have the capability or the wherewithal to do. But I think I share the sentiments of some of the other colleagues about some concerns that really make it difficult for us. And for me, it's really the erosion of trust that we used to have in certain institutions. And those institutions are widespread now. It's healthcare, it's the government, It's our schools and teachers, and that's a shame that that's happening. And really, because of that erosion, some of it is justified due to miscommunication and missteps during the early phases of the pandemic, and even more recent ones. But it doesn't that does not overshadow the fact that these are people who dedicated their lives to make other people's lives better, and they do so under a foundation of science and fact and not fear and misinformation. And so that erosion, I think, is what our challenge is right now, and trying to overcome that so that people can once again feel safe and comfortable and trust in institutions who only exist to their benefit.
Thank you. I appreciate you all sharing a glimpse into some of the things that you're struggling with and faced with on a daily basis. Appreciate your honesty. And so let's get started, shall we? We know that currently, based on what Dr. Gilkey shared for information, COVID-19 rates in Maine are higher than ever before. Yet we are not in a state of emergency, and many organizations and places of business have returned to some pre-COVID behaviors and practices. For instance, holding in-person conferences with luncheons, buffets, etc. So there appears to be a disconnect, or is there one? I'm going to throw that one to Dr. Gilkey.
Jim, I think I may agree with you. Maybe I should be the moderator. Her questions are hard.
This is an attendee's question, so the credit goes to somebody in the audience.
True. Well, what I would say is the state of emergency is a governmental level release of resources to mount an attack. And that was particularly useful a year ago when there was so many unknowns. And at a certain point, all of us fondly remember this past June when life seemed to be returning to normal and the state of emergency was declared over. I think that when the government is looking at it, particularly influenced by Maine CDC and National CDC, really looking at it in a very comprehensive way. What's the mental health impact on this? What's the ability to educate our children with this? What kind of mandates would be useful or not useful? Do we need actually declaration of state of emergency to make those decisions? I think that all goes into the pot and gets stirred up and spits out. I do think that there is a disconnect, and the disconnect occurs at the level of the public and behavior. I think we find ourselves in a situation with the Delta variant right now, and Delta variant accounts for 99% of all the isolates in this country. So the most highly transmissible and arguably the most infectious of the variants that we've seen is with us right now. I think that we're seeing some breakthrough on the vaccinations, not unexpected. The vaccines are doing a pretty good job of preventing severe illness and certainly deaths, although not 100%. So with that, it makes perfect sense in the public when you're indoors to try to maintain appropriate distancing and definitely to utilize masking. I think all of us, and probably our entire audience, has experienced here in Maine to go in any public environment. Some people are masked, some people are not. I think it's time to be masked and to follow the public health rules that we became accustomed to a year ago. Very appropriate. And then we'll be talking more about boosters and what role that plays and how we might get ahead of things again, I'm sure, coming up.
Thank you, Dr. Gilkey. Yamaya, can you touch upon this from a mental health perspective? Because certainly I think that is something we're all grappling with right now.
Yeah, thanks. It's tricky without this kind of like rule from above that the onus comes on each one of us to figure out our comfort with risk and our willingness to make some personal sacrifices for the good of the community and helping to end this pandemic. I know I'm like many of you, I was pretty relieved for a few months there when I wasn't as diligent about masking, and I'm definitely back to always wearing a mask indoors. And it's hard because it's important to be having difficult conversations sometimes with family members or community members, or I'm a parent, and so if my kids are going to be around other kids and parents, how are we having those hard conversations about safety? So it's hard to step into those uncomfortable places when we already are holding so many challenges that are coming with this pandemic. So it's adding an increased layer of just stress to people's lives to have to kind of figure out what is their and their family's path forward with how to interact in the community. I just encourage people to, take the precautionary principle, right? Like, you might as well wear a mask inside. It's not going to hurt. It's not that much. It doesn't require that much effort. And we've all been doing it for a really long time. We can do it for a longer, and acknowledge too, it's not, it's not ideal. And we can have feelings about it being frustrating. We can have feelings about, I hear from people a lot of anger for those who have chosen to be vaccinated, at others who are choosing not to, or and having to, figure out, how do I just focus on what I can control, which is I can wear a mask, I can choose to get vaccinated, I can be kind to people in my community, and just recognize everyone's figuring out their way forward as best possible. But it's not easy, Karen.
Thank you, Maya. So many feelings that we're struggling with, but I love the fact that you ended with, we can all choose to be kind. So thank you for that. I'm going to throw the next question to Dr. Marnick. We're going to dive into booster discussions because there's a lot of questions about that, both before today and in the question and answer function. So we know that the FDA recently authorized a booster dose of Pfizer for certain populations. The authorization of the booster for those in high-risk occupational institutional settings was contrary to the advisory panel's recommendation, which has caused some to question is this truly safe? So, given the variance in those recommendations and the decision making there, should this cause concern?
Yeah, so first, I want to just remind people of all the levels that this goes through. So first, when Pfizer submitted documents for EUA for the booster, it first went to the committee at the FDA, and then the committee voted on it. And when the committee voted on it, they voted to approve boosters for people over 65, people with high-risk medical conditions, and people in high-risk occupations. The FDA director then agreed with that and signed off on it. And then that's the first step. And then the second step is where it goes to the ACIP. And in the ACIP meeting, I actually was able to attend that virtually. I was listening to their discussion, and it was a very close vote. So 9 voted against, 6 voted for. So there's only a difference of 3. And the biggest issue they had was not concerns over safety. They were worried about whether or not it was actually needed for this population, because we know that vaccines are still working. We know that they are still working very well. And we do see a drop in some efficacy, especially for those with medical conditions or those who are elderly, but we don't have the data yet to say that that is also true for people with high-risk occupations. And then at the end of that vote, a bunch of the members wanted to actually change some of the wording because they were worried it was a little bit too broad and would allow too many people to get boosters who maybe don't actually need it yet, but they were running out of time. So then Dr. Walensky at the CDC ultimately decided to go against the ACIP's decision, but to side with the FDA in saying that these people with high-risk occupations should be able to get a booster if they decide to. And she had some important reasons for that. The one primary reason being that we know that if somebody who isn't a medical worker or a teacher gets a breakthrough infection, they're likely going to be fine because the vaccines are still working really well. But that person is going to then have to quarantine for a significant period of time. That's going to overburden our already really stressed healthcare system where we already don't have enough staffing. And that's going to overburden our schools that have the same issues. There's not enough teachers. There's not enough substitutes. So she was looking at it more from that policy perspective. But overall, there wasn't any concerning things with safety. It's more so, is it actually needed for that population? But then ultimately, everybody else agreed that it was needed because it would decrease the risk of breakthrough infections to help keep those people working, which is an important factor.
Thank you so much for that clarity. I always learn so much from you. So I try to invite you. We try to invite you as often as you'll come to these Zoom conferences. So thank you so much. You're going to get the follow-up question. Is there a physiological reason for us to have to wait 6 months for getting the booster?
So 6 months is the earliest where we start to see antibody levels dropping. So antibodies are what circulate in your blood. They are really important in helping to block initial infection. And the data we have shows that those start to decline at 6 months. So that's when a booster wouldn't be needed. Getting one sooner likely wouldn't have much benefit because you haven't yet gotten to the point where the antibody levels are dropping enough to justify a booster.
Great, thank you. The next question is going to be for you, Dr. Jarvis, and this one is a hard one because I know you're ready for it. You've had your coffee, you're ready for it. The authorization includes people aged 18 to 49 years old with underlying medical conditions. Are there specific medical conditions that qualify? And what makes one medical condition qualify while another does not? And doesn't that create health equity concern?
So I'll answer the last part first. It does create health equity concerns because some of this is about judgment. And so while the FDA does have a defined, and the CDC do have a defined list of medical conditions that might be included in this category, it is not an all-inclusive list. And really, in some cases, deserve to have a look at by the individual and their care provider to have that discussion as to whether or not they should qualify. Clearly, when we're talking about individuals over the age of 65 or those who are 49 to 65 years old who have significant health concerns such as diabetes, heart disease, lung disease, cancer, those are pretty much absolutes for us. But when you start talking about those under the age of 49, then it really has to be that discussion. So, is your diabetes well controlled? Is your high blood pressure well controlled? Do you have any other risk factors? Are you at risk for exposure, such as the occupational exposures that we just talked about? And so I think there really needs to be a discussion there. Not everybody, it's not a one size fits all. And of course, that also has to then do with the judgment of the healthcare provider and their interpretation of what the CDC and the FDA have made as far as recommendations go. For Northern Light Health, we've been pretty liberal in this discussion that if a healthcare provider does recommend this for a patient, we're not questioning that. We're just going ahead and giving it. Really the only hoop that you have to jump through is that 6-month mark, that it has to have been greater than 6 months, and that it was Pfizer that you had administered and not any other. So, but big risk categories, again, being treated for cancer, some people who are survivors of cancer, people with heart conditions, people with lung conditions, people with diabetes, people with high blood pressure. That's a pretty big category. And then we add to that overweight and obese individuals. And really, you're talking about the overwhelming majority of individuals who are over at least the age of 20, but probably even lower than that here in the state of Maine.
Thanks, Dr. Jarvis. There's some timelines that people are watching closely and others are losing track of because there's just so much information coming out. Can you give us an update on the Moderna and J&J, as well as a timeline or an estimate on children under the age of 12?
Yeah, so those are great questions. So both the FDA and the CDC, and particularly the CDC's Advisory Committee on Immunization Practices, have scheduled meetings from now until about Halloween. I believe each of them actually has 3 separate meetings scheduled coming up, each with a different topic and focus, and they don't necessarily parallel each other in timing. But I believe the first one will be looking at Moderna and Johnson & Johnson, particularly Moderna, as to whether or not they should, boosters should be included for individuals who are more than 6 months out of their final vaccine in either one of those 2 series. Then they will also look at whether or not we can mix and match vaccines, meaning that if you had originally received Pfizer, could you receive Moderna as your booster? Or if you had Johnson & Johnson, could you receive Pfizer as your booster? There are some countries around the world that are already doing that. Some of that stems from the fact that very early on in the vaccine process, they did not have an adequate number of vaccinations to complete a series with an individual product, and therefore had to mix and match in order to provide some level of immunization for their general population. In the United States, that was never the case here, so we did not do that here in the United States. And so there's some question as to whether the efficacy is better to do mix and match, better to do single, or just to consider both at the same time. And then lastly, if it's children under the age of 12 and whether or not they would qualify for the Pfizer vaccine. That's probably one that most people are most anticipating and most want to hear about, but it's probably going to be the last one in the series, at least that ACIP, or the Advisory Committee on Immunization Practices, looks at, and that'll probably be just before Halloween. The reason for that is they were asking for more data from Pfizer, and Pfizer submitted that data today. And again, I think that's just evidence that when we talk about the safety profile for these vaccines, the FDA and the CDC, and particularly their subcommittees, do an excellent job of making sure they have all the facts first before they make a decision. So in this case, they asked Pfizer for more information. Pfizer provided that information today, and in fact feel that they have provided enough information that they could go ahead and request emergency use authorization for children age 5 to 12. And so that's where we're at. I do anticipate that sometime either the week before or the week after Halloween, we'll probably have guidance on all three of those factors that I just said, and then it'll probably be a period of time, maybe a week or two before things change. That could be accelerated just depending on what they determine on each of those meetings that they have. So sometime around Halloween. Let's look at Halloween as hopefully a joyous time again.
Well, I sure hope you're right, Dr. Jarvis. And I know that people are very anxious to get those boosters. When it is authorized and people are given the go-ahead to get the boosters for Moderna and J&J, I assume the administration of that will mirror what we're offering now for the public with Pfizer, and that people can contact their PCP or the local Walgreens. I assume there's a distribution plan already in place when we get the go-ahead.
Correct, Karen. So both at the federal level and here at the state of Maine level, we have been working behind the scenes, almost for a year now in every phase of the vaccines that we talk about. And in fact, last July was when we started what our vaccine rollout program was going to be in the inevitable event that vaccines were approved or authorized. And we continue to do that when we start talking about boosters and with the change in criteria for age for those with the primary series. And so, yes, all of those things are worked on and will pretty much mirror what we're currently doing for the Pfizer vaccine.
Wonderful. Thank you so much. The next question, Dr. Marnick, is somewhat of a follow-up to what Dr. Jarvis shared for information. And admittedly, it's a little bit of a selfish question. It's one that I submitted in advance of the Zoom conference. And that is that I have an 11-year-old who I am anxious to get vaccinated, but I do have concerns that, the 11-year-old's almost 12-year-old. So is it best for me to wait? How do I know that my child will be as equally protected at that age? And so I'm hoping you can give those of us who have 11-year-olds a little bit of information as to what we should do.
Yeah, so honestly, this is kind of hard to answer because Pfizer hasn't actually made the data publicly yet. Once those meetings happen at the end of this month, the data will be publicly available. And the data should include looking at different ages and seeing how well they responded to the vaccine. It's likely going to be comparable in terms of protection, but that's something that you would have to discuss ultimately with your son's pediatrician. But I think it's important to remember too that getting protection sooner versus later is always better, especially if that child is in school and is going to be exposed. And right now, a lot of cases in schools are pretty high right now. So getting protection sooner versus waiting until they're 12. But that is a valid question. And I think a lot of people also have questions about how vaccine dosage is done in general. And it's not done like other medications. Other medications are based on weight. And vaccines, the way that they do the dosage is based on the average immune system development for that window of time. So for 5 to 11-year-olds, they know their relative average immune system development and what dose is needed to get most of those kids having a really good response. So hopefully we'll actually see the data soon, but likely it won't matter, and getting protection sooner is going to be better than waiting.
Thank you, Dr. Marnick. I look forward to seeing that science and having you back to help us understand it. I will also ask you the next question of you, and that is that recent reports indicate that Moderna might have more longevity in terms of protections compared to Pfizer, yet they're both mRNA vaccines. And so people are wondering why there is a difference. Are you able to kind of shed some light to that, explain that variance?
Yeah, so Moderna and Pfizer are very, very similar. They both are mRNA. They both have that fat bubble that's protecting them. There is one difference though, and that is actually that Moderna has more mRNA per dose than Pfizer does. So the differences that we're seeing with Moderna, it looks like it is lasting a little bit longer. It's not having as much waning as quickly as Pfizer, is likely due to that fact, is to the fact that it has more RNA initially, so that the people who get vaccinated with Moderna produce just a slightly more robust immune response that ends up lasting a little bit longer. But it's also hard because Moderna was rolled out later than Pfizer. So it's a little bit confounded by the fact that, is it just that people haven't been vaccinated as long with Moderna as they have been with Pfizer? So there's a little bit of confusion there, but the consensus seems to be that yes, Moderna seems to be slightly more effective in terms of not waning as fast. And that's likely due to the increased amount of mRNA it has compared to Pfizer.
Thank you so much.
So Karen, I have a comment
go ahead,
about
Dr. Gilkey.
boosters as well. You know, it's interesting. When we started out sort of in December, looking at the data, we saw that the Pfizer and Moderna seem to be protecting us at an efficacy of 90, 95%. And I think overall we were thrilled with that. Where we stand now, you know, the 6-month, the 8-month discussion, Moderna versus Pfizer, which one lasts longer, we're talking about efficacy that's in the mid to high 70s still. Keep in mind that when it comes to an immunization, we're looking for it definitely to be over 50% efficacious. And once you get into the 60s, that's a very good vaccination. So we're really, in a way, splitting hairs. And I do think that, you know, people are going to be very interested, like myself, in getting that booster along the way. I'd rather be in the 90s than in the 70s. There's no question about that. But let's not lose sight of the fact that these are really good vaccinations to start with, and even at the 6 and 8 month mark.
Thank you, Dr. Gilkey. I think that was an important addition, so I appreciate you chiming in there. We have a question in the chat box that actually was also submitted prior to today's Zoom conference, so it's clearly top of mind. And Dr. Jarvis, I'm going to ask it of you. It was announced last week that pharmaceutical company Merck has created a pill that reduces the risk of hospitalization and death from COVID-19. Can you tell us what you know about this, and do you have any idea when it might be available?
Yeah, so things to remember. One, this is a medication versus a vaccine, and so the process is a little bit different in approval than it is for vaccines. And there's a lot of good reasons why the process is different than when we're talking about vaccines. So this is preliminary data that has come out that shows that it seems to work very, very well in preventing severe disease and hospitalization, and may even work in hospitalization to prevent people from dying, and that's wonderful news. I think what people need to understand is, one, it's not ready for marketing anytime soon, and so it's going to be a period of time, even if they use an expedited process to get there. Why? Because unlike when we were talking about the vaccines, that production and research were done at the same time due to the fact that governments supported that, that's really not the case with this pill. So there will be a manufacturing delay that will happen as a necessary part of the process. But what I think everybody needs to understand is this is not a substitute for vaccination. And people who receive this medication, even if it might save their life, may still have long-term effects from being sick with COVID-19. I kind of liken this to, would you want, if I told you that we had a pill that made a cold, we had 2 pills out there, one that made it so you never had a cold, and one that made it so that your cold, was shortened by a couple of days. Wouldn't you want to take the one that made it so you didn't have the cold in the first place? Now we're not talking about a cold. We're talking about a severe disease that has severe long-term effects in many individuals. Vaccines help prevent that from happening at all. This pill will only prevent it from happening in a few people. And so while it's good news that we have something on the horizon, better to not get the disease at all than to count on a pill that may make that disease better.
Thank you, Dr. Jarvis. I think that just people are so anxious to have hope. And so Yamaya, I'm going to throw this to you as kind of a follow-up. They're grasping on this as hope, but there's also those in the clinical realm, the experts saying, don't put all your eggs in that. We need to get prevention, focus on prevention in that vaccine. So, how do you balance that?
Yeah, I think that people are often looking, forward and wanting to know what can I look forward to and how can I really make sure and keep myself and my family safe. And I think that that's a great thing to be looking forward. And I also think it's important to pause and just recognize how far we've all come in this. I think it can get really easy to just feel the weight of it so heavily and focus so much on that what is not working well and what is constrained about our lifestyle now. And like Dr. Jarvis said, it's amazing that we have these very effective vaccines and have had a really amazing rollout of these. And we have this opportunity to
Oh no, we lost her.
that we have
Oh,
individually. Oh, go ahead, Karen.
no, you paused, but keep going. We can hear you now.
Okay, so we have that capacity. And then, I think as individuals, it's really important to recognize how much we've been holding and how well we're actually doing at it. That we have adjusted to working like this, many of us. And, we would have never been doing this before. We've adjusted to all different ways of maintaining social connection. And we've just had to be so versatile and flexible. And we really should pause every once in a while and just lift our head up and see what's working. And there is a lot that's working in our communities and in ourselves interpersonally, that we've been able to get through really hard stuff. We can keep getting through hard. We've got a winter ahead of us. That's not going to be great for many people who don't love winter. And we can just find ways, but it may mean sometimes reaching out and getting some professional help and accessing some services. I know that a lot of therapists in the community have pretty long waiting lists right now, which can be a little challenging. So my real suggestion for people, particularly as they're looking towards winter and trying to think of things to be hopeful for, is to, take inventory of yourself. Know, if I know winters are typically hard for me, how can I be preventative? How can I be intentional about creating a wellness plan for myself? And I want to draw people's attention to a great resource offered through the state of Maine, the Strengthen Me program. I'll put the link in the chat, but free resources for people around the state. It's great for employers, employees, anyone. Lots of different wellness strategies, mental health support that I encourage everyone to access.
Thank you so much, Yamaya. We'll also make sure that that's included in our resources that are on our Northern Light Health page that people can access in future dates. The next question I'm going to throw to you, Dr. Gilkey, it was submitted by one of our participants, and it's a good one. How do we define vaccine efficacy? Not getting infected, not getting hospitalized when infected, not dying from the infection. Can you help us understand?
I can. So vaccine efficacy strictly means reduction of disease. So you could see efficacy reported as prevention of mild disease, moderate disease, severe disease. We've heard it broken up in a couple of ways in the reporting over the last year, for sure. I think the vaccine efficacy that I was referring to before was a significant reduction in the severe disease. So that's where the hospitalizations come in. I think it is used interchangeably with prevention of infection as well. I think that's somewhat of a misuse of it. It really is about the disease or not disease. So people can be infected and pass it along, but we'll still see high efficacy rates for preventing severe disease. So I think that's what's driving the discussion for the COVID-19 vaccines.
Thank you, Dr. Gilkey. Dr. Jarvis, the next question is for you, or I'm hoping that you can help this employer field employee exposures. So what is the current recommendation for small businesses who have an employee who tests positive? Should the business temporarily close and ask employees to quarantine? Do the recommendations change if all the employees are vaccinated?
Yes, that's a difficult one to answer specifically on, and it really has to do with the kind of business that you have. And so, if that was the experience that a business had, I would say, reach out either to your work health department or to the Maine CDC for specific advice, because one, it changes, and two, it matters by having to do that contact tracing. I am often confronted with, well, there was somebody at my office who was positive, and I want to know if I'm at risk. And when I, further look at those details, the person who was positive works exclusively on the 5th floor, and the person who's asking the question works exclusively on the 1st floor. And in fact, they haven't seen each other in months. The person who worked on the 1st floor isn't at risk for that. But if you're in a building where everybody interacts all the time, then obviously there is exposure and there is risk. The risk goes down, obviously, if you have mitigation strategies such as universal masking in place, if there's barrier protections up, and of course, if everyone is vaccinated. Any one of those breakdowns changes what the requirements and recommendations will be. However, for the person who is positive, yes, indeed, they need to be out of work and quarantined.
So if I heard that correct, Dr. Jarvis, you're recommending that even small employers have a connection with an occupational health provider that they can tap into for guidance if they feel this.
Yeah, and if they don't, then they can reach out to institutions like the Maine CDC.
Great. Thank you so much for that clarity. Dr. Marnick, the next question is for you. This is actually a question that we fielded at our last Zoom conference when Dr. Massey was here to talk a little bit about a monoclonal antibody treatment. The question was, what's the science behind it? Can you explain it? And of course, time didn't permit him to answer that question. I'm hoping you might be able to help break down the science for us in a way that we can digest it and better understand.
Yeah, that's a great question. So when somebody gets vaccinated or when somebody gets an infection, their body makes a bunch of different kinds of immune memory cells. And one of those kinds of memory cells are antibodies. And I mentioned before that one of the main jobs of those antibodies are to recognize the virus if you're exposed to it and help block the infection. And then the other memory cells, they have really important roles in helping you not get as sick if you do get infected. So the way that monoclonal antibodies work is that it's giving you antibodies that recognize the spike protein on the virus without being vaccinated, though sometimes the monoclonal antibodies are used for people who are also vaccinated. But it's essentially giving you an infusion of those commercially made antibodies that will help block the virus and help you eliminate it more quickly than if you hadn't gotten a treatment overall. So it's based on what happens normally in an immune response because people's immune systems make antibodies, but it's giving them to an individual artificially through an IV so that it helps their immune system clear the infection faster.
Wonderful. I don't know how you do it, but you do it well. Dr. Jarvis, this monoclonal antibody treatment is really about trying to keep people out of the hospital. And recently, during one of our Zoom conferences, you talked about the strain on Maine health systems right now. At what point are we going to reach a breaking point where our systems are at max capacity? In other words, how much more can we take in the state of Maine?
Yeah, that's an excellent question. I will say that, if we took the state of Maine as a whole, and particularly the areas that Northern Light Health Service, thankfully we are seeing a decline in the number of hospitalizations from COVID-19. However, we were already under strain before the pandemic started, and we continue to have hospitalizations and needs beyond COVID-19. And so there is still some of that inner workings. And we have some pockets around the state where we continue to see hospitalizations not just plateau at a high level, but actually continue to increase. With that said, we also know that there is a large amount of community spread. How much more can we take is a good question. Again, I think it's because of the things that we did as a state from the very early stages of this pandemic that continued all the way up through this morning of working collegial together, trying to find ways that we can help one another. And the fact that we have such a high vaccination rate means that we are not at that breaking point, nor do I think that we're going to reach it, because it does look like there's some good news on the horizon for us. We are not like some other states where frankly, they had to cease doing healthcare in many fashions simply because they were overrun with patients. Thankfully, we never closed our doors to patients for reasons other than COVID-19. And we were able to expand services, like you said, with monoclonal antibodies. Just a few weeks ago, we were not doing as many monoclonal antibodies as we're doing now. In fact, Northern Light Health has increased by almost a factor of 10 the amount of monoclonal antibodies we've been able to do at the same time when we started doing booster vaccines and continue to do outreach. And that's true for just about every other health system in the state. We have really positioned ourselves to kind of ride through these peaks and valleys of this pandemic. But at any moment, we get a new variant that's more contagious and causes more severe disease than the current Delta one. And then we're talking about something different. How do we protect ourselves? It's all about vaccination.
Yeah, and to follow up on that, Dr. Jarvis, if vaccinated people can get the virus now and they're transmitting it to other people, how do we see an end to this pandemic?
Yeah, so my hope is that we will see an end to the word pandemic, which really has to do with how widespread the disease is globally. Do I feel that we will ever get to a point where we won't be talking about COVID-19 or COVID in general or coronaviruses in general? No, I think this will become something like we talk about with influenza. We know that we have seasonal flu. We know that we have other variants of the flu that pop up from time to time. And this is what I think we're going to be seeing with coronavirus. This particular mutation of the coronavirus that caused COVID-19 and all of its subsequent variants is very different than what we've seen in the past, and really does seem to be acting from a respiratory virus standpoint, much in the way that we see with other seasonal respiratory viruses that cause severe disease. And so, yes, I do think we're going to be living with it, and I do think that we will probably need to be talking about booster shots or even annual vaccinations, much like we do with influenza, unfortunately.
Thank
Can
you,
I add,
Dr.
Karen?
Jarvis. Yeah, go ahead,
One
Amaya.
piece there is I think that that's so important to make note of, and when we're thinking about our population's mental health, that that we all get a little more comfortable with that reality, right? That I hear people say all the time, I can't wait to get back to normal. I can't wait for this to be over. Like, I'm holding back on creating a life that is worth living well until this ends, right? I'm just kind of tightly holding on and, you know, putting my head down and just doing it, but I'm not well. And I think that we all need to embrace a reality that this will be with us in one form or another, hopefully with increased vaccination and all the great work that our public health infrastructure is doing to really mitigate the risks. It won't be as pronounced by any means as it is in our day-to-day lives now, but we are all going to have to learn ways to live with this well. And I think that the sooner we can make that kind of mental shift and begin to embrace how can I live well in this reality, that we're not going back. And I think that that's something we should all just take into consideration.
Yes, and that's, go ahead,
Sorry.
Dr.
Sorry.
Marnick, go ahead.
No, you can say something first. I just
No, please add on.
So I agree with what Dr. Jarvis said. The only thing I wanted to add to that is that I think there's a big misconception in the media, especially, that vaccination does not decrease your risk of transmission. And I just want to emphasize the fact that that is not true. So we now have a lot of data that shows that the vaccinated individual, yes, they can still get infected. Yes, if they're infected, they could potentially still pass it on. But we know that once you're vaccinated, you're still less likely to be infected. So if you're not infected, you can't pass it on. And then we also now have data that shows if you do become infected, you're sick and you're contagious for a shorter period of time, which means you'll infect less people. And they've cultured virus from people vaccinated and people unvaccinated. And the people who are vaccinated have less virus that's actually contagious. And then a new study just came out this past week in the UK showing that people who are vaccinated do still infect less people than somebody unvaccinated. So I think a lot of people are like, why do I even get vaccinated if I'm young and healthy? Because I could still spread it. But it's important to remember that if you compare yourself to somebody unvaccinated, once you're vaccinated, you're not going to be able to spread it as much as somebody who's unvaccinated. Yes, you still may be contagious. That's not guaranteed, but it's still less than somebody who is unvaccinated. And that's going to be an important factor in overall helping to decrease the burden of infection circulating.
And that's such an important thing to clarify, Dr. Marnick, because you are hearing more and more, well, why would I get vaccinated? They don't even work. And so bringing that clarity and having that messaging with your family, friends, your employees, colleagues, that's so important. So I appreciate you sharing that, and certainly something we'll continue to reiterate when we convene this group, so our audience can have that talking point ongoing. Dr. Gilkey, we had a couple of questions prior to today's Zoom conference that are related, and that is essentially, what are the best practices for businesses to keep their employees and customers safe? We certainly talked about precautions many times before, but with all the changes, what should employers do? And if they have the ability to essentially segregate their employees that are vaccinated or their customers into separate space, is masking still advised, or can they go without a mask?
Well, I think we've learned that the infection is with us, and whether we're vaccinated or not, we have to be concerned that we can get it and pass it along. So, to the extent that we can continue to run our businesses, to separate people appropriately, we were using the 6 feet distance as the way to manage that. That still needs to be in place, along with indoor public masking. I think that's much more critical than people are appreciating right now. We really need to do that and do it effectively. And while we sounded like a broken record, I do think certain messages need to be reiterated. And that's for a mask to work, it has to be form-fitting around the nose and down below the chin. So, having a tight-fitting mask in indoor public places is critical at this point. But I think working around that will be important. Now, of course, we're seeing a lot of that principle being ignored, shall we say. I'm a football fan, and I watch football on Sundays and Mondays and Thursdays. But having said that, it does strike me how these events are super spreader events. And I do think that that's partly why we're seeing, hundreds of thousands of new cases reported on a regular basis. I think that's part of the reasoning. So we need to get back to the basics and, buckle down and follow the simple rules that are out there about distancing and masking.
Thank you, Dr. Gilkey. And Yamaya, I'm going to throw the last question to you because I think it's something that we are all struggling with, trying to navigate. And that is, we know that some folks are not masking, others are. Some have varying beliefs, some are at greater risk than others. And yet we have to continue, right? We have to figure out a way to live in this new world. And we have children who want to go play at a friend's house. How do we navigate that? How do we feel safe having those conversations with other families, with other business owners, with our customers?
Thanks. It's hard. I'll just acknowledge that first and foremost. And then say, I think each one of us just needs to get really clear about our own, comfort, values. I know, for me personally, I am more apt to visit those businesses that I know are really safe places. I go to my local grocery store because they require masks. And I am making decisions for myself and my family. And we've had, sit down conversations as a family about why are we making these choices, and why can maybe I not allow my child to do something that a friend is being allowed to do. And we just open up the dialogue and really talk about safety and really talk about doing our part as members of a community to help end the current state of this pandemic. And it's tricky and hard. And I also encourage people to know when it's time to lean into difficult conversations and when it's not, right? When it's painful for our own mental wellness to get into a power struggle with someone that's not going to go somewhere. Otherwise, just, and when it's important to just say, this is what I'm doing, this is what's right for my family, and leave it at that. Sometimes that's going to be in the best interest of everybody.
Thank you so much. On that note, I think it's a good time to say thank you all for joining us, and a special thank you to our panelists today. Just a reminder, you can find the recordings of all of our Zoom conferences as well as resources that we reference on our Northern Light Health website. I hope this hour has been a help to support you, your employees, your families, our communities. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on October 21st, when we will talk in depth about treatment options for COVID-19 long haulers, as well as tips for living with continued stress. We will send you the link for this session, and we encourage you to share the invitation with your friends, colleagues, and others who might benefit. By working together, we will keep Maine safe. Thank you, and have a wonderful afternoon, and enjoy this beautiful fall weather. Take care.